When you hear about global health, many of us are first reminded of the starving nation of Ethiopia, the AIDS epidemic in Africa, and the growing number of obese humans across the nation. Global health may seem foreign, but it is actually growing all around us. According to the International AIDS Vaccine Initiative, HIV has caused one of the most devastating pandemics in human history, claiming nearly 30 million lives. I am here to inform you about why this is important to you, and why you should help different organizations to lower the risk of disease all around the world. Global health is a huge topic, not only because it is affecting your hometowns with problems like obesity, but it is also affecting our surrounding countries with HIV, AIDS, and other diseases. In the next few minutes, I am going to tell you about global health and how it affects our world so that you can be better informed about the issue at hand. Global health not only includes overseas countries, but it also includes the United States. In the United States, I am sure that you have heard about the growing obesity problems of our younger generations. Obesity simply means having too much body fat. Obesity can come from a number of factors, including genetic makeup, overeating, eating high-fat foods, and not being physically active. Being obese is very dangerous because it dramatically increases your risk of diabetes, heart disease, stroke, arthritis, and even some cancers. The World Health Organization states that as of 2000, the number of obese adults has increased to over 300 million, and in developing countries it is estimated that over 115 million people suffer from obesity-related problems. Also, according to the World Health Organization, globally around 35% of adults aged 20 and over were overweight in 2008, and around 12% of adults were over 20 were obese in 2008. In 2013, Liz Neoporent for ABC News states that an additional 60 minutes of physical education time lowered the probability of obesity in 5th grade by 4.8%, and did so without cutting into academics or harming test scores. Since I have informed you about our nation and how obesity affects it, next I am going to tell you a little about how HIV and AIDS affect surrounding countries. I am sure throughout your life you have been told about the dangers of HIV and AIDS, but what I am sure you have not been told about is how dangerous and deadly it is in countries that do not have the benefits of antibiotics or medicine that help with those diseases and others like it. In 2000, Lester Brown states that in 2000, 24 million Africans were infected with HIV. In the absence of a medical miracle, nearly all will die before 2010. Each day, 6,000 Africans die from AIDS. Another each day, an additional 11,000 are infected. HIV and AIDS are not the only thing that has had an outbreak. More recently, on June 14, 2013, it has been reported that by the World Health Organization that yellow fever has broke out in Ethiopia. In response to the outbreak, the Ministry of Health of Ethiopia launched an emergency yellow fever mass vaccination campaign to help prevent the outbreak to continue any further. Due to the fact that HIV and AIDS are a huge issue, the African leaders have been and are currently embracing the shared responsibility and call for innovative solutions to accelerate the response to AIDS, tuberculosis, and malaria. On September 26, 2012, according to the UNAIDS, the African leaders gathered in New York to discuss long-term sustainable strategies to finance and provide access to HIV treatment and prevention services and other health services in Africa. Now that I have told you a little bit about global health and a few issues dealing with global health, I hope you're more informed about the topic. Global health is a huge topic, not only because it is affecting your hometowns with problems like obesity, but it is also affecting our surrounding countries with HIV, AIDS, and other diseases. There is much to be done about our global health, from trying to make our schools healthier by simply adding in more PE time, or helping the nation's countries that don't have the resources to help prevent HIV and AIDS. If you are more concerned about the growing problems of our nation's health and the growing problems of our world's health, then there are many ways to help. One organization that you could help is the UNAIDS. Their mission is to lead and inspire the world in achieving universal access to HIV prevention, treatment, care, and support.